In this video, we will show you how to use an automated blood pressure machine typically located at doctor's surgery. Coming right up. Blood pressure is the pressure of blood inside the arteries that move the blood around the body to the brain, the heart and the kidney. When the pressure is too high, the vital organs start to fail. This leads to heart attack, stroke or kidney failure, for example. Before taking blood pressure, you want to avoid things that can raise blood pressure, such as recent exercise, eating within the past half hour, drinking coffee, smoking, or even feeling the need to go to the toilet. You want to wear a t-shirt or something a bit loose with just one thin single layer. You want to rest for about 5 minutes so you're feeling really relaxed and comfortable before taking blood pressure. So, this is our automated blood pressure machine. The hole in the middle is where the arm is going in. The start button on the top is where you are going to press to start reading. There are 3 numbers on the top to be aware. The top number, called systolic, is when the heart is beating, is always higher, and the second number is when the heart is relaxing, called diastolic. The third number is your heart rate, which can also go up when you are excited or stressed. To start your reading, you will have a chair next to the machine. You want to insert your bare arm into the arm insertion section up to the top of the shoulder like this. You then press start button and the cuff will automatically inflate and then deflate automatically after around 1 minute. The result will be displayed and a printout will be printed. General rule of thumb, blood pressure should be generally below 140 and 90. Your heart rate should be below 100, and you can repeat the blood pressure reading 2 more times and see if you can get a lower number. Try to wait a couple of minutes before each reading